been on the show before, helping us with our sore shoulders, backs, and whatever else ails you. Well, today, Tasso Spanos from the Center for Pain Treatment is back to help us with another big problem for many people, headaches. This is a good topic.
Good morning.
Nice to see you back here.
Oh, it's lovely to be back.
And tell us about tension headaches specifically.
Well, we're talking about
right?
a tension headache, and there are many tension headaches. They could be in the back, the side, the top of your head, but we're going to talk about one particular one. We're going to talk about a headache around the eye, or on top, or above the eyes.
This is one of my favorite headaches.
It is, and around the eye, there's the one muscle. It's called the sternocleidomastoid headache. Now, some people out there I know have very big headaches, and the headaches are getting bigger and bigger, and they're taking more and more medicine, and somehow their headache medicine might be looking this big by now.
Okay.
So if you've got this kind of a headache, we're going to try to help you this morning.
You want us to get away from that.
That's
All right. So what can you do without any of that gigantic medicine?
Well, the headache around the eye and the sinus congestion, and also your eyelid might tear on you.
Yeah.
You turn your head to the side like this.
To the side that's bothering you.
To the side that's bothering you, and then bring your chin down and stretch this muscle right here. It's called the sternocleidomastoid. Now, it also can cause blurred vision. It can cause sweating on one side of the eye, and it can cause a lot of other symptoms which are thought to be other things, but they're really connected with this muscle.
Okay, so turning and down all to get this muscle.
To the side, that's bad. But to make it even, we're going to do the other side also. So we'll turn to the side as far as we can, and we go down. And this is part of a series of headache stretches that we have on a videotape that we've talked about before.
Okay, so this is something that you should be doing even when you don't have the headache.
Preventative is the thing to do.
Okay.
Who wants to have a headache?
Right.
It's prevention that we want. So that now there's another part of that muscle, and that part of that muscle is the back part of the sternocleidomastoid muscle. So we turn our head now away from the side that's hurting us, but you're not quite sure what side because it's over both eyes anyway. So you're going to do both sides again.
Okay.
So we turn our head to the side, and this time we bring our chin up. Bring our chin up and hold that for 3 seconds. Now this part of the muscle, besides causing a headache over the eyes, let's bring it to the other side. It can also cause dizziness on getting up quickly from bed.
Wow.
You think your ear is itchy, or you think there's water in your ear, but there isn't water in your ear. And you can have a pain inside your ear, or you could be have fluctuating hearing. In other words, you hear pretty good on Monday, not so good on Thursday.
Okay.
So that's it. So we have prepared a sheet of paper. If the listeners call our phone number at the center, 412-431-9180, we have a piece of paper that tells you that this particular headache over the eyes, around the eye, then it tells you the extra symptoms, and it tells you the stretch, all lined up, so it won't be so confusing. And we'll be glad to mail it to them for no charge.
Oh, great. That's wonderful. We'll have all that information for you, too, everybody, in just a second here. But again, just to target this one kind of headache, I'm sure you have treatments for all kinds of other ones as well.
We treat this muscle ourselves at the center. We have therapists who treat this muscle. But we found out, and then we give the patient a stretch to maintain the work that we've done, but we found that these stretches can actually help the person if they do many of them, and it helps, as you said, to prevent the problem.
That's great. Great advice, as always. So nice to see you again.
It's great.
Thanks
it's
for
just
coming
great.
back.
How's the new baby doing?
The new baby's doing perfect. He's a good one. He's a good one. He's a keeper, let me tell you.
They're all keepers.
They're all keepers.
But this one really is, right?
He is. Now here's some information on how to reach Tasso Spanos at the Center for Pain Treatment. His office is located on Pittsburgh's South Side. The number is 412-431-9180, 412-431-9180. And don't worry if you don't have anything to write that down. We have a link to it at our website, kdka.com. All right.